Let's discuss this now with Alex Wild from the Taxpayers Alliance and Janet Davies, Chief Executive of the Royal College of Nurses. Alex, I'll start with you. As John Craig was saying there, the firefighters have been offered 2%. Is it inevitable that the dam is going to burst now and that you're going to see lots of other plus 1% awards?
Well, I'm not really sure. I mean, we've got to be realistic about the state that the public finances are in. We're about 1.8 trillion in the red. We're borrowing £6.5 million every single minute. Every single hour, rather. But what I would say is I do think this highlights pretty much how stupid the way in which we conduct these kind of pay negotiations is in Whitehall. We have basically nationalised pay bargaining, and this leads to some public sector workers in very poorer parts of the country, say for instance the North East, being relatively overpaid, crowding out the private sector in the process. We also end up with people working in the public sector in more expensive places like London being relatively underpaid. And as Janet will tell you, this is quite bad, especially for things like NHS trusts, because they struggle to compete in the labour market in London. They have to hire in more agency staff. Agency staff's much more expensive. It's bad for workforce planning, and it's actually really quite bad for health outcomes as well. So I do think that there is a case for sort of pay increases for some parts of the public sector, especially actually nurses in high-cost areas. But I don't think that we can afford across-the-board pay increases. I mean, nurses are, I think there's about 350,000 nurses, about 120,000 police officers, and about 40,000 firefighters. That's only about 10% of the public sector workforce. I mean, are we seriously saying that we think that council press officers and council social media officers all desperately deserve a pay increase as well?
But surely the point is, though, every single worker in the public sector has had a real terms pay cut since 2010. Don't they deserve a pay rise?
Well, there's been a bit of a correction, really, because once upon a time it was the case that the public sector received very generous defined benefit pension schemes in return for being paid less. This sort of changed quite a lot in the 2000s, and there's still a pay premium in the public sector, actually, once you account for things like the size of the employer, gender, age, qualifications. People in the public sector are still paid about 2% more than people in the private sector, and that's before you count things like pensions, which are much, much more generous in the public sector.
OK, Janet, well, what do you make of that? I mean, that is a point. I mean, the average public sector pays, I think, £505 a week. In the private sector, it's £464 a week, and that's even before you take into account the fact that public sector pensions are more generous.
But if we compare the salary of nurses against other graduates, their earnings and their earning potential is much less. So that isn't actually the case for nurses at all. There are some nurses who can get onto those higher salaries, but the average nurse is earning nothing like their colleagues in the private sector. And actually, that's what we're seeing now, because we're seeing people leave nursing. So for the first time, we know that the more nurses leaving the register, that means they're leaving nursing entirely, than there are coming on. So we've hit that crisis point. The pay review body for nurses actually said, and that's the health service workers, actually said that this was unsustainable when they reported earlier on this year. And we're certainly seeing that. It's becoming increasingly difficult to staff our hospitals and communities. We're using very expensive expensive agency staff to supplement those 40,000 vacancies that we have. That actually is not economical in itself.
What did you make of Alex's point that you should have regional pay bargaining in the public sector? I mean, if you did that, nurses in places like London would get a huge pay boost. You wouldn't get this issue about having to put aside housing for them and things like that.
Well, there is actually something within the agenda for change, which is the pay scales in which health service staff are paid, which does allow actually for more money for those high-cost areas.
Doesn't fully reflect.
And they also have recruitment and retention premia. We believe that it's for a national health service, there should be a national salary. It means that there's easy to move people around. People can get jobs in any area for the same sort of salary. The other thing, of course, is it might be beneficial to our members, but when we're in a position we are at the moment with 40,000 vacancies, we do see, as we see in other economies such as America, we find that nurses' salaries get higher and higher and higher as people compete for those staff, and of course that's why London has that higher rate of pay.
Alex, one of the points that Jeremy Corbyn made today, somehow or other Theresa May managed to rustle up £1.5 billion for the DUP. The optics of this don't look very good for people like Janet's members, do they?
Well, no, they certainly don't, but I mean, that's modern politics, isn't it? I mean, politics is largely an exercise in bribing people with other people's money, and the only difference is this time it's happened after the election rather than before the election, because we had a hung parliament. I don't approve of these kind of deals. I think that taxpayers completely resent it. but it also does show how unfair the sort of funding formula is. Relatively poor English regions do extremely badly compared to places like Scotland because of the Barnett formula. The whole way in which we finance the home nations is totally unfair, and this has just further exacerbated it.
All right, Fred, we've got to leave it there. Janet Davies, Alex Wild, thanks for joining me both.